we are here to know about sunscreen and melasma from an expert. So let's connect today with our skin expert, Dr. Roopal Bansal, live from Delhi to talk on sunscreen, an integral part in the treatment of melasma and hyperpigmentation. Dr. Roopal has completed her MD and DNB specialization in dermatology from JNMC AMU, Aligarh. Doctor has 8+ years of experience in the field of dermatology and aesthetic medicine. Dr. Roopal is currently consultant dermatologist, trichologist, and dermatosurgeon. She is the director at Dr. Roopal's Skin Clinic at Sector 75, Noida, consultant dermatologist at Kailash Hospital, Sector 71, Noida, and Jeevan Anmol Hospital, Mayur Vihar, Phase 1, New Delhi. She has many articles published in national and international journals. Doctor has expertise in treatment of acne, pigmentation, skin allergies, and hair fall, and is well versed with various skin and hair rejuvenation and anti-aging treatment. It's such a pleasure to have you with us, Dr. Roopal Bansal. A very warm welcome and good evening to you.
Good evening, Sayukta. Thank you so much for the warm welcome.
And Dr. Roopal, today we are going to talk on a very important topic. It's important because it's very common. इंडिया में हम देखते हैं हमारी सोसाइटी में बहुत सारी स्पेशली वुमेन्स हैं जो हाइपरपिगमेंटेशन या मेलास्मा से सफर कर रही हैं, तो ऐसे में बहुत जरूरी हो जाता है कि हम इस पर बात करें और साथ ही साथ सनस्क्रीन का क्या रोल है इस पर भी आज हम इस सेशन के दौरान बात करेंगे. सो फर्स्ट ऑफ ऑल वी वुड लाइक यू टू टेल अस व्हाट इज मेलास्मा एग्जैक्टली.
So melasma is a condition where we get brown colored patches on the face. So basically, it's a kind of hyperpigmentation condition wherein hyperpigmentation means increased colorism, increased darkness of the skin. And this melasma occurs mainly on the face, on the nose, forehead, or upper lip, or sometimes on the jaw area and other extrafacial parts of the body also. So it's a very common condition, and it occurs because of many risk factors are there, like sun exposure, using of some cosmetics, fragrance material. So that is how melasma and other hyperpigmentation of the skin looks like.
Now, now there is a little bit of confusion for laymen specifically. They'll feel that, whatever is happening over our face in terms of darkening, if we can say in a very common language, it's hyperpigmentation. So melasma and hyperpigmentation, are they the same or there is a difference between them?
So hyperpigmentation is a very broad term, and it comprises of all the entities which cause darkening. So hyperpigmentation is a broad term, and melasma is one type of hyperpigmented skin condition. There are other conditions also which can cause spots or dark patches on the face, like freckles, or maybe pigmented contact dermatitis. Some dermal nevus cause pigmentary disorders. So there is a condition known as lichen planus pigmentosus. So hyperpigmentation is a very broad term in which we see dark patches over the skin, and melasma is a specific term inside the hyperpigmented skin disorders.
So we can say that all types of melasma is hyperpigmentation, but all hyperpigmentations can be melasma, right? Now, you said the sun exposure is one of the very common cause of melasma. What are the other causes? What factors are responsible for melasma, doctor?
Yes. So basically in melasma, there is increased pigment formation. The pigment is naturally present in all our skin. So, but at some places, the pigment formation is excessive, and that leads to the brown patches. And the factors which lead to this kind of excessive color formation, first of all, is hormonal profile, because there is hypersensitivity to the hormone, already present hormone in the cells, that leads to increased pigment formation. So this hormonal reasons could be maybe due to any hormonal medicine intake, or sometimes hormonal disorders that the person might be having, like thyroid disorders or other hormonal disorders. So first would be hormonal, second is sun exposure, because the pigment formation, it occurs as a result of sun exposure. When the sunlight UV rays fall on the skin, then the cycle of pigment formation occurs. So sun exposure would be the second cause. Sometimes it's vascular causes also, And other trigger factors are fragrance materials, fragrance, and some cosmetics. They can also trigger the formation of melasma.
Right. Because you were talking about the hormonal changes, etc., and how it can cause melasma. Now, pregnant women many a times experience melasma.
Right.
What's the reason behind it, and does it go away on its own, or we need some special kind of treatment for that?
Yeah. So as I was saying, because it's because of hormonal imbalances or sometimes hormonal levels, they lead to formation of these dark patches. So in pregnancy, there are some hormones that are on a higher side during pregnancy to sustain the pregnancy, and those hormones are responsible for the formation of dark patches. And as after delivery, as the hormones they subside to the normal level, the pigmentation also gets better, but sometimes it remains as such also. And therefore, not only after the delivery, but also during pregnancy, it's warranted to have proper prevention and proper sun protection so that melasma doesn't develop.
Okay. And we'll definitely talk about, what precautions we can take later. But before that, doctor, we would like to know, कैसे पता चलेगा कि हमें melasma हो रहा है? क्या कोई symptoms हैं या सिर्फ जो signs है, जैसा कि आपने बताया कि, dark patches होते हैं चेहरे पे, कुछ और exposed parts में. So, are there any symptoms or signs for melasma?
Yeah, melasma is something that you can just see. In the mirror, when we see there are some brown patches, especially they occur on the convexities of the face, like the nose, the malar, the exposed part of the face, the cheeks, the forehead, the upper lip area, the jawline. So we find brown patches, the large patches with irregular border on the face. So this is the only sign and symptom of melasma. There is nothing else. There won't be any itching. There won't be any pain. So there will be just darkening of the skin that will occur.
Right. And you as a doctor, how do you diagnose? Just by physical investigation or some other tests or scans are also done?
No, scans are generally not required. We take a detailed history because there are other forms of pigmentation that I just enumerated that also present in the form of dark patches over the face. So we have to rule out those conditions. The color of the darkness also helps us in reaching a proper diagnosis. When the color is sometimes in some pigmentation, the color is a little bit brownish. In some pigmentation, it's a bit of grayish or bluish discoloration. So that is how it helps us to differentiate. And also there is a test known as dermoscopy, in which that's a handheld kind of microscope, and we can see the microscopy of the patches, the pigmentation that is present on the skin, and that will further help us to not only diagnose but also classify melasma under which category this kind of pigmentation is falling. It's superficial like epidermal melasma, or is it deep like dermal melasma?
Okay, so it can also go deeper. I mean, and what are the reasons for that? I mean, because mostly, we have again this tendency of ignoring our signs or not consulting the right person, which is a qualified dermatologist, in case we see some kind of abnormality on our skin. So, is it because of the delay that we, normally do in consulting a doctor, taking proper treatment, etc., that it goes deeper?
No, it's not always because of the delay. Some people can they have a tendency. It's melasma is also has a genetic predisposition. Many people whose mother have melasma, they have a higher chances of getting melasma. So melasma being epidermal or dermal, being superficial or deep, is mainly because of genetic factors and not just because the person is ignoring it. It's not entirely because of ignorance.
Right. Many times people who are diabetic or people who are suffering from thyroid balance, they also complain of melasma. Are they also at the risk factor? Are they also at risk?
Yes, thyroid has a risk factor, and it's been seen that the patients, the people who are having thyroid hypothyroidism, are 4 times more prone to develop this kind of melasma than the normal population.
Okay. We often say that prevention is better than cure. Any way to prevent melasma, doctor?
The only way is proper sun protection. Sun protection would be the most important step in preventing melasma. Second would be to always watch on the medicines that you're taking, and always discuss with your physician if any hormonal medicines the person is taking. And third would be to avoid any kind of fragrance material around your face, because that also can trigger not just melasma but also other kind of pigmentation on the face.
Right. But as you said, sun protection is the most important thing to prevent melasma. How to protect our skin from the harmful radiations of sun, doctor?
So first of all, sun protection is very, very important. And there are various methods in which we can protect ourselves from sunlight. Most important being sunscreen. So everyone, not only to prevent melasma, but also to prevent various other causes, various other manifestations of sun damage, like aging and other sunspot development, and seborrheic keratosis for that matter. So sunscreen is very, very important. That has to be applied half an hour before stepping out. And even if the person is indoors, to protect from the visible light and from the screen lights, from the blue light, sunscreen is very important. And apart from sunscreen, we can wear broad brimmed hats when we are going out. And if possible, we can cover the face with a cotton cloth. That is also a way of sun protection. And take lots of vitamins, especially vitamin C, that acts as an oral sunscreen. So all these would be the method to protect from sunlight.
Right. So sunscreen is very important. Other than that, physical sun barriers are equally important, like broad brim, hat, etc. Now, for sunscreen, you said that even if you are inside, even if your sun exposure is not much, still you need to have sunscreen. But many a times, people who are working from home or their offices or commuting through car, which is, fully air conditioned, or women, because they are mostly working in the kitchen, etc., the exposure and the sun is very less. But then you said the screen light, the, other lightings, LEDs, etc., they are equally damaging to our skin. Please, we would like you to shed some more light over that, because people are really ignorant. They feel that sunscreen is something that protects you from the sun.
Yeah, that's a very good point, and it's a very common myth that is prevalent among us. I see patients daily who say the same thing that you're saying, that I stay indoors and I don't go outside, and even if I'm going outside, I'm in a car, in an air-conditioned car. So first of all, the damaging part of the sunlight is the light part and not the heat part. So be it summer, be it winter, if you're inside a air-conditioned car, that doesn't matter. If you're getting exposed to the light part of sun, then you're getting exposed from the sun rays, and you're the harmful part of the sun rays. So we have to take care. If it's shiny outside, if it's the sun is shining, then we have to put on a sunscreen. Also, the LED lamps, the screens, these also emit lights, and these can further cause sun damage. Not that much that what the outside sun will do, but yes, they do cause damage to the skin. So we need sun protection inside also, especially if you're outside. We have to wear sunscreen. We have to repeat the sunscreen, and indoors also sunscreen is very much required.
Right. So irrespective of where are you working from, or, having your routine inside or outside, you need to have sunscreen on your skin. Now, the thing is, whenever we go out to buy a sunscreen, there are so many things, so many details, informations written on the box of that sunscreen. One major factor is SPF. Now, what is SPF? What is the, proper, because it starts from, I think, 15, 20 and go like 70, 80. How much SPF is okay for us?
Okay, so SPF is basically sun protection factor, sunburn protection factor, and it's the measure of the UVB protection of a sunscreen.
Okay.
So basically for Indian skin, any SPF above 30 is fine, especially for preventing melasma. SPF above 30 is fine, and it would provide around 97% protection from from the UV rays for causing sunburn. And melasma would occur at very low dosage than the sunburn dosage. So any SPF above 30 is fine.
Right. So any SPF above 30 is fine. Now,
Right.
apart from the SPF, there are other details on the box as well, like it's, one thing is that it's medicated or not. Then there are so many other things. What are the basics to look for, doctor?
Okay. So that also depends on what kind of skin that you are having, and what is the issue that we have, what is our concern basically for what the sunscreen is being prescribed. So on a general basis, sunscreens can be either physical or chemical sunscreen. Physical sunscreen basically have minute tiny particles of zinc oxide and titanium dioxide, which reflect the sunlight, which reflect the light that is falling on the face, and that is how they provide sun protection. And chemical sunscreens have chemicals like avobenzone, oxybenzone, and cinemates that modify the effect of the sunlight, and they prevent from the effect of UV rays from falling on the skin. So one is chemical sunscreen, the other is physical sunscreen. Physical sunscreen, as a general rule, they provide a better protection, they provide a broad spectrum protection. And chemical sunscreen, they provide a specific kind of protection to your skin. And also it depends on the condition of your skin. If you have a dry texture skin, then you might require a creamy formulation sunscreen. And if you have a oily skin, then you might require a dry texture sunscreen or a gel-based sunscreen. That would be more suitable for you. So as a general, physical sunscreen would be better, that most of the people will tolerate well. But the sunscreen also has to be individualized as per your concern and as per your skin.
Definitely. So as per your skin type, as per your working conditions or whatever conditions you have, like an athlete who is, under the sun and who's sweating a lot, or a swimmer, their sunscreen will definitely different from what person who's mostly working inside an office or, under controllable circumstances are. So for that, again, we can go and consult a dermatologist and seek suggestion that which sunscreen to take, which sunscreen will suit us, and follow that religiously. Apply sunscreen regularly, religiously. That's really important. I'll quickly take a few questions from our viewers, then we'll move on to other questions. Faria Beg is here asking, is there a natural remedy or lifestyle change that can help reduce the appearance of my melasma?
Natural remedy, I would say sun protection is quite natural if you're not using sunscreen and just putting on a cloth. So that would be a natural thing. And as we just discussed, prevention would be better. So whatever other modifiable factors, we can't change the genetics. If we are prone to get melasma, we can't change the genetic part. But rest of the parts we can still modify. We can protect, we can have good amount of sun protection. We can avoid fragrance material around the face. So these things we can do. But yes, if we are genetically prone, then we have to undergo treatment only.
Right. I would also like to add to her question that many times, whenever we see melasma or pigmentary disorders, on our skin, rather than going to the doctor, we'll first try some hidden trial things, some home remedies, or apply something on our skin, or we'll ask a friend or a relative who had gone through the same problem, or we'll go over the counter, ask the chemist ki, मुझे ये melasma हो रहा है, या melasma नहीं भी पता है तो मुझे ये pigmentation हो रहा है, तो कोई दवाई बता दो. So we'll go for over the counter medication. Home remedies या किसी दोस्त या रिलेटिव से सजेशन लेना, उनके प्रेस्क्रिप्शन को फॉलो करना, या over the counter medication, इन्हें आप किस तरह से देखते हैं डॉक्टर?
I strictly discourage. ये बिल्कुल ही गलत practice है, because first of all, even to diagnose melasma is not possible for everyone. And it is up to the dermatologist, it's up to the specialist to diagnose if the condition is melasma or is it some other condition of hyperpigmentation that is occurring on the skin. And so the only home remedy that a person can do by himself is sun protection. Prevention is the only thing that a person should do. And applying anything, especially even the vegetables that are present, I always ask my patient, sometimes somebody is applying tomato, sometimes somebody is applying cucumber, I just ask, eat them. आप खा लीजिए इसको, but don't apply it on your face, because you never know what condition you are having And
Right.
this doesn't work for everyone. The other person, your neighbor, might be having something else and you are having something else, and you won't be able to diagnose it. It's up to the specialist to diagnose it.
एग्जैक्टली तो जो खाने की चीजें हैं उन्हें खाइए, वो
Right.
आपके चेहरे पे रिफ्लेक्ट होगा, उन्हें चेहरे पे लगाइए नहीं। और कुछ भी करने से पहले डॉक्टर को दिखाना बहुत जरूरी है। स्किन जो है हमारी पर्सनालिटी का एक बहुत बड़ा हिस्सा है। अगर उसके साथ हम एक्सपेरिमेंट करेंगे और उसके रिजल्ट्स अच्छे नहीं रहे तो डॉक्टर को भी बहुत लंबा वक्त लग जाता है फिर उसे ठीक करने में या जैसे वो थी उस कंडीशन में उसे लाने में। इसलिए अगर कुछ भी दिक्कत है स्किन से रिलेटेड, स्कैल्प से रिलेटेड, सबसे पहले एक क्वालिफाइड डर्मेटोलॉजिस्ट को दिखाइए। एक और बहुत अच्छा सवाल हमारे एक व्यूअर ने पूछा है, राहुल बंसवार है, पूछ रहे हैं कैन फेशियल स्पा क्योर मेलास्मा? क्योंकि जब इस तरह की चीजें होती है तो अगेन जो हमारे पार्लर्स होते हैं, सलून्स होते हैं, उनपे भी हमें बहुत भरोसा होता है। हमें लगता है कि यहाँ पे जो फेशियल है ऐसा दावा भी किया जाता है कि वो आपकी स्किन को बिल्कुल पहले जैसा कर देंगे। डॉक्टर,
So facial spa will give you the hydration that you need. तो जो रूखापन है, रूखापन चले जाएगा, आपको एक ग्लो आएगा, हाइड्रेशन थोड़ा मिल जाएगा, बट पिगमेंटेशन से में बहुत ज्यादा फर्क नहीं आएगा। मे बी थोड़ा 19-20 आपको कुछ टाइम के लिए टेम्परेरीली यू माइट फील अ बिट ऑफ lightening or bit of glow on your face, but on a long term basis facial spa won't help with the pigmentation on your face.
राइट। कई बार क्या होता है हम होम रेमेडीज में, ओवर द काउंटर मेडिकेशन में, फेशियल्स में, इन सब चीजों में इतना वक्त जाया कर देते हैं कि जो कंडीशन है वो और ज्यादा वर्स हो जाती है। और जब तक हम डॉक्टर के पास पहुंचते हैं तब पता चलता है कि अगर हम बहुत पहले आ गए होते तो ट्रीटमेंट बहुत आसान होता, अब ट्रीटमेंट ज्यादा लंबा चलेगा। तो इसलिए अगर इन सब झंझटों से बचना है, यू वांट टू सेव ऑन योर मनी, ऑन योर टाइम, ऑन योर एनर्जी, on your skin, please go and consult a qualified dermatologist as soon as you recover that something is not normal which is happening on your skin. कीर्ति कपूर है, पूछ रही है, is it safe to undergo cosmetic procedures such as chemical peels or laser treatments to reduce the appearance of melasma, doctor?
Yes, definitely. These are prescribed treatments for treatment of melasma. So apart for the treatment, we give various kind of remedies. We can give various kind of procedures for the treatment of melasma. The basic being a day cream and a night depigmenting cream that helps with the lightening of the patches, and that depending on the requirement, depending on the depth of melasma, depending on the type of melasma, there are other procedures that we go for lightening of the patches. These include chemical peels. These are further subdivided like so superficial peel, medium depth peel, deep peels that help with the pigmentation. Also there are lasers, Q-switched anti-ag lasers that help with the lightening of melasma. So yes, definitely we should go for these procedures, but always under the supervision of a qualified dermatologist.
ये बहुत जरूरी पॉइंट आपने बोला डॉक्टर, बिकॉज दे आर सो मेनी क्वैक्स, यू नो, दोज हु आर नॉट क्वालिफाइड बट दे हैव स्किन क्लिनिक्स और पार्लर्स एक्सेट्रा हु क्लेम कि उनके पास पीलिंग हो जाता है, उनके पास दूसरे प्रोसीजर्स हैं जिससे वो ट्रीट कर सकते हैं हाइपरपिगमेंटेशन एंड मेलास्मा जैसी कंडीशन। तो वो कितना खतरनाक हो सकता है?
वो बहुत खतरनाक हो सकता है, बिकॉज दे डोंट हैव द प्रॉपर ट्रेनिंग एंड दे डोंट हैव द प्रॉपर नॉलेज of the human skin. They don't have the proper knowledge how melasma is formed, what is the target cell that we are targeting with the help of laser, what is the target, what is the depth of the peel that we are using, what could be the side effects and how to manage the side effects. So even we see a lot of patients coming with facial burn after getting peels from quacks or other unqualified practitioners. So it's either I always advise, don't get treated at all. Either treat with a qualified dermatologist or just don't go for any treatment at all.
बिल्कुल, हमारे हाथ में सिर्फ प्रिकॉशन लेना है और वो प्रिकॉशन है एक अच्छा सनस्क्रीन। वो सनस्क्रीन जो हमारे स्किन टाइप के हिसाब से, वो सनस्क्रीन जो हमारी जो भी वर्किंग कंडीशन है उन सब का भी ध्यान रखता है। और उसके लिए अगेन आप एक डर्मैट का सजेशन ले सकते हैं। उससे ज्यादा कुछ मत कीजिए, एक्सपेरिमेंट बिल्कुल मत कीजिए। ये भी हम जानना चाहेंगे, थोड़ा बहुत ट्रीटमेंट पर बात हुई, लेकिन अगर उसके और यू नो एलैबोरेट करके हम जाने, जब एक पेशेंट आपके पास आता है और आप क्लिनिकल या फिजिकल एग्जामिनेशन से पता करते हैं कि ये मेलास्मा है या क्या कितना डीप मेलास्मा हुआ है, What treatment then you suggest? Line of treatment क्या होता है, क्या क्या उसमें होता है?
Yes. So the treatment is, apart from sunscreen, we add depigmenting creams. Depigmenting creams, they contain various kind of ingredients like hydroquinone, kojic acid, arbutin. So basically, all these chemicals, they arrest the formation of pigment in the cells, and that is how they cause the lightening of the pigment that is already present on the patches. Apart from the depigmenting cream, we also sometimes, depending on the skin, we also advise sometimes vitamin C serums or niacinamide serums. That also help. They have antioxidant effects and they take care of the oxidative stress that also increases the pigmentation on the skin. So there are depigmenting creams and serums. Then there are vitamin C serums that we prescribe for the lightening. And apart, if added to that, we sometimes give oral medicines, some oral sunscreen, some oral tablets in the form of tranexamic acid, which lead to lightening of the pigmentation. And then there are various procedures like, as we just enumerated, chemical peels and lasers, which help with the lightening.
Right. कई बार एक बहुत आम सा सवाल होता है जो मेलास्मा जिनको है, आई एम श्योर आपसे भी आपके पेशेंट पूछते हैं, क्या ये परमानेंटली जाएंगे, क्या हमें इनसे परमानेंटली निजात मिलेगी, विल इट परमानेंटली गो अवे? व्हाट्स योर स्टैंड ऑन दैट, डॉक्टर?
So I just say this to my patient that because ये हमारी बॉडी ने बनाया है, तो हमारी बॉडी अगर एक बार बना सकती है तो 2 बार भी बना सकती है और 3 बार भी बना सकती है. So basically melasma light हो जाता है, it gets better, it gets lighter, but it can keep coming back. And so it's very important to have good protection, as we've been speaking about this for so long, sun protection and other factors. So we have to keep preventing ourselves from the maximum we can go do for prevention of melasma. We should go for that. But this is a recurring condition. ये आता जाता सा रहता है, and we'll have to continue with a little bit of treatment for long.
ओके. पवन पार से हमारे एक व्यूअर हैं, उनका सवाल है, which skin type is mostly more prone to melasma?
So the darker kind of skin type is more the Indian skin. How we grade it is Fitzpatrick grade 4, 5, and 6. So the darker kind of skin is more prone to develop melasma, and the lighter, the white population is not that prone to develop melasma.
ओके. डॉक्टर, चूंकि हम सनस्क्रीन की बात कर रहे हैं और हमने कहा कि वो सबसे अच्छा प्रिवेंशन हो सकता है, और जब ट्रीटमेंट की भी बात आती है तो भी सनस्क्रीन डॉक्टर्स भी सजेस्ट करते हैं उस हिसाब से. ऐसे में एक और सवाल यहाँ ये भी उठता है कि कई बार हमने देखा है, एक तो सनस्क्रीन को लेकर तमाम तरह के कंप्लेंट्स होते हैं, इट मेक्स माय स्किन वेरी पैची, और इट मेक्स माय स्किन वेरी डल, और आई स्वेट अ लॉट आफ्टर यूजिंग सनस्क्रीन, और आई हैव अ वेरी ऑयली स्किन, व्हाई शुड आई यूज सनस्क्रीन, बिकॉज़ इट विल मेक मी इवन मोर patchy. How do you address these reasonings or complaints?
So as I said, sunscreen has to be individualized as per the person, as per his condition, his skin type. We have to individualize the sunscreen. So basically we have a very diverse kind of skin types. So some people have acne prone skin, so we have to give them a certain type of sunscreen. Some people have very dry kind of skin, so they need different kind of sunscreens. Also according to the exposure, we have to change the type of sunscreen that is required for the person. So the most of the physical sunscreens, they form a layer and they can lead to a lot of sweating. So we have to change the sunscreen accordingly, according to the skin type, according to the requirement, and according to the concern of the patient.
Right. आपने कहा कि जेनेटिक फैक्टर भी हो सकता है, फैमिली हिस्ट्री मैटर्स इन टर्म्स ऑफ melasma. अगर किसी के फैमिली हिस्ट्री में melasma है, what should he or she do?
So the only thing, we can't change the genetics, to be frank. We can't change that part, our proneness to melasma. So we have to watch on the medicines that the person is taking. And for the females, so when they get pregnant, they have to be even more cautious about the cosmetics they are putting on their face. And about the sunscreen, they have to use a good physical barrier sunscreen during pregnancy, because genetically already they are prone to develop melasma. And pregnancy is the time where the hormone changes occur, and that is the time when the melasma starts appearing. So they have to be extra cautious than the rest of the pregnant females for preventing their skin from getting the melasma.
राइट चूंकि आपने प्रेगनेंसी का जिक्र किया, एक तो होता है कि प्रेगनेंसी जब नहीं है तब किसी को मेलास्मा दिख रहा है, साइंस दिख रहे हैं, और वो होम रेमेडीज या ओवर द काउंटर मेडिकेशन, टॉपिकल क्रीम्स एक्सेट्रा खुद से लेके लगा रहे हैं, व्हिच इज वेरी हार्मफुल, व्हिच कैन बी वेरी डेंजरस एज यू हैव ऑलरेडी एक्सप्लेन। प्रेगनेंसी में तो ओवर द काउंटर मेडिकेशन और ज्यादा हार्मफुल हो सकता है। तो ऐसे में ये और कितना ज्यादा जरूरी हो जाता है कि अगर एक प्रेग्नेंट लेडी को अगर मेलास्मा हो रहा है या हाइपरपिगमेंटेशन ही दिख रहा है या फिर उनकी फैमिली हिस्ट्री है और फिर ये साइंस दिख रहे हैं, तो वो पहले डॉक्टर को दिखाए, खुद से ट्रीट करने की कोशिश ना करे।
Yes, definitely, it's very important. And also, I would like to add that sometimes what people do after consulting, after just having a single consultation with the doctor, they keep on continuing the medicines. So that is also a practice that has to stop, because there are the medicines, they have a expiry date, not only on the shelf but also on your face. So you can't just keep on applying the medicines which was prescribed maybe 1 year back to you, and you can't just keep on using them because it works fine for you. And also in pregnancy, there are many oral medicines that are not allowed. Also the topical medicines, very few topical medicines are safe. And even sunscreens also, there are in pregnancy we prescribe only physical barrier sunscreen. So during pregnancy, it's very important that the lady should consult her dermatologist, and accordingly she should, if she is suffering from melasma before, then she has to get it altered according to her pregnant status. And if she has developed melasma during pregnancy, then she has to start the treatment accordingly. And over-the-counter medicines are a strict no, because most of the over-the-counter medicines will contain steroids, and for very short-term benefit, they'll give you very good glow and they'll work very well in the next week. But in long term, they'll harm your skin and they'll make your skin very thin and prone to send heat, and they'll make your skin burn like anything.
Right. तो प्रेगनेंसी में तो खास तौर पे ध्यान रखना है, ओवर द काउंटर मेडिकेशन का बिल्कुल इस्तेमाल नहीं करना है और डॉक्टर को दिखाना है। इनफैक्ट सनस्क्रीन भी अगर आप चूज करते हैं तो वो भी डॉक्टर की सलाह से ही करें, ये बहुत जरूरी है। और जैसा कि आपने डॉक्टर कहा कि जो ओवर द काउंटर मेडिकेशन हम करते हैं, जो टॉपिकल क्रीम्स हम केमिस्ट से पूछ के लगाते हैं, शुरू में बहुत अच्छा असर दिखता है, वो बिल्कुल मैजिक की तरह वर्क करता है, हमें लगता है कि यही है जिसकी तलाश थी। और वो भी एक बहुत बड़ी वजह है कि हम डॉक्टर के पास इनिशियली नहीं जाते, क्योंकि हमको लगता है कि इसी ने तो इतना वंडरफुल काम कर दिया, हम क्यों किसी डॉक्टर के पास जाए। फिर धीरे धीरे हमारी स्किन को उसकी आदत लग जाती है, क्योंकि वो स्टेरॉइड्स होते हैं, हमें नहीं पता कितना लगाना है, कब नहीं लगाना है, कब धीरे धीरे उसको कम करना है। और जब तक हम डॉक्टर के पास पहुंचते हैं और डॉक्टर फिर बहुत एक तरह से हम कहें कि जहां 0 से काम शुरू होना था, वहां बहुत नेगेटिव में ऑलरेडी हम जा चुके होते हैं, वहां से फिर शुरू करना पड़ता है। तो ऐसे में और कितनी ज्यादा दिक्कत होती है, कई बार स्किन बहुत थिन हो जाती है, जैसा कि आपने कहा जल जाती है, लेकिन हमें तो ये पता है कि जो क्रीम हमने लगाया था उससे मेरी स्किन बहुत अच्छी हो गई थी। तो ये एक मेंटल वर्क भी होता है, उनको समझाना, उनको कंसल्टेशन देना कि जो हम लगा रहे थे वो एक्चुअली बहुत डेंजरस है हमारे लिए।
Yes, it's a very difficult situation, because it's very common. बहुत ही कॉमन है कि पेशेंट्स ओवर द काउंटर मेडिसिन लगाते हैं, एंड मोस्ट ऑफ देम कंटेन वेरी पोटेंट स्टेरॉइड, जो फेस की स्किन के हिसाब से दे आर क्वाइट पोटेंट एंड क्वाइट स्ट्रॉन्ग। एंड जब उसे बहुत लॉन्ग टर्म पे लगाया जाता है, मे बी अराउंड 2 months और 3 months, और समटाइम्स वी सी पेशेंट्स हु बीन यूजिंग देम फॉर 1 year 2 years, तो इससे बहुत ज्यादा साइड इफेक्ट्स आते हैं। धीरे धीरे करके स्टेरॉइड से इफेक्ट बहुत जल्दी मिलता है, बिकॉज इससे वैस्कुलर चेंजेस जो होते हैं, इन्फ्लेमेटरी मीडिएटर्स, दे वैनिश अवे इमीडिएटली। सो एक ग्लो आता है, एक ब्लश आता है फेस पे, जो पेशेंट्स को बड़ा अच्छा लगता है कि इमीडिएट रिजल्ट हमें मिला है, स्किन एकदम क्लियर हो गया है। बट स्टेरॉइड्स लॉन्ग टर्म यूसेज से दो प्रॉब्लम्स होती हैं. एक, स्टेरॉइड्स के अपने साइड इफेक्ट्स तो होते ही हैं, ऑल्सो उसका एफिकेसी धीरे 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 करके कम होते चले जाता है. सो जो इफेक्ट हमें फर्स्ट एप्लीकेशन में मिली, इन 3-4 दिन में मिल गया था, सेकेंड एप्लीकेशन में वो 2 वीक्स लग जाएंगे, 3 वीक्स लग जाएंगे, तब जाकर वो इफेक्ट आएगा. तो एक तो उसका इफेक्ट स्लो होते चले जाता है, और साइड इफेक्ट्स में स्किन थिनिंग होती है, फेशियल हेयर ग्रो होने लग जाते हैं, पिंपल्स आने लग जाते हैं, बहुत ब्लड वेसल्स देखने लग जाते हैं, ब्लड वेसल्स बिल्कुल सुपरफिशियल आ जाते हैं, तो फेस रेड लगने लगता है. और जो पर्सन अगर कहीं गर्म चीज, कोई चाय कॉफी लेता है तब उसे बर्निंग होती है, गैस के सामने जाता है तब उसे बर्निंग होती है, धूप में जाते हैं तो बर्निंग होती है. तो इस तरह से बहुत सारे साइड इफेक्ट्स आते हैं. और एज ए डॉक्टर जब हम इस तरह के पेशेंट्स को देखते हैं, तो बहुत सारी मेडिसिन हैं जो हम उनको ऑन द फर्स्ट गो नहीं दे पाते हैं, बिकॉज उनकी स्किन इतना थिन हो गई है कि वो कोई भी मेडिसिन, कोई भी इवन टॉपिकल मेडिसिन को भी टॉलरेट नहीं कर पाएगी. सो सबसे पहले हमें उनकी स्किन को बिल्डअप करना पड़ता है. उनकी जो अट्रोफी हो जाती है, स्किन पतली हो जाती है, उसे दोबारा नॉर्मलाइज करना पड़ता है. एंड आफ्टर दैट वी गो फॉर द ट्रीटमेंट ऑफ द पैचेस वॉट एवर इज रिमेनिंग. सो जो ट्रीटमेंट हम 2 वीक्स या 2 मंथ्स में देते, वो 6 मंथ्स में खिंच जाता है ट्रीटमेंट.
बिल्कुल, तो इसीलिए बहुत जरूरी है कि अगर आपको लग रहा है मेलाज्मा के साइंस हैं, तो प्लीज गो एंड कंसल्ट अ क्वालिफाइड डर्मेटोलॉजिस्ट. उसके अलावा कोई ओवर द काउंटर मेडिकेशन नहीं, कोई पैक्स या पार्लर बेस्ड ट्रीटमेंट्स नहीं करना है हमें मेलाज्मा या हाइपरपिगमेंटेशन का. हेल्दी अगर हमारी स्किन होगी तो डेफिनेटली हम प्रिवेंट कर पाएंगे. सनस्क्रीन तो एक आपने बताया जो बहुत इंपॉर्टेंट है. इसके अलावा भी हम रूटीन में जो स्किन केयर रूटीन होता है, मिनिमम उसे रखते हुए, बेसिक रखते हुए, क्योंकि बहुत ज्यादा वक्त लोगों के पास नहीं होता, क्या कुछ कर सकते हैं डॉक्टर? कौन से बिल्कुल बेयर मिनिमम बेसिक्स हैं?
यस, सो द बेयर मिनिमम बेसिक्स वुड बी, सबसे पहले तो एक माइल्ड क्लेंजर से person should wash their face. Cleansers containing hydroxy acids are preferred because they contain lightening agent. So AHA, BHA containing cleansers से सबसे पहले face wash करना है. उसके बाद depending on the skin types, vitamin C serums can be used or niacinamide serums can be used. And then after that apply moisturizer as per your skin type, and then the sunscreen. This would be the AM routine which has to be followed in the morning, and sunscreen has to be reapplied every 2 to 3 hourly. So because एक बार का जो sunscreen होता है उसका effect 2-3 hours में भी off हो जाता है. So it's always it's as important to reapply the sunscreen so that उसका effect जो है, उसकी efficacy है, वो maintain रहे. And at night time, after cleansing the face with the AHA BHA containing cleanser, एक डीपिगमेंटिंग क्रीम जो हम लोग प्रिस्क्राइब करते हैं. सो द डीपिगमेंटिंग क्रीम्स हैज टू बी अप्लाइड डिपेंडिंग ऑन द क्रीम. मेनली वो पैचेस पर अप्लाई किया जाता है, एंड ओवर दैट मॉइस्चराइजर बेस्ड ऑन योर स्किन टाइप. सो दिस शुड बी द बेसिक रूटीन that any patient, any person with melasma should follow.
Fair enough. And before we sum up the whole session, any takeaway message for our viewers, doctor?
So the takeaway message would be कि मेलाज्मा इज वन ऑफ द कंडीशन ऑफ हाइपरपिगमेंटेशन. बहुत सारी और भी कंडीशन हैं जिसमें पिगमेंटेशन होता है, लाइक एक्ने मार्क्स होते हैं, या फ्रेकल्स होते हैं, या पिगमेंटेड कॉन्टैक्ट डर्मेटाइटिस होता है. उसका ट्रीटमेंट, सभी कंडीशंस का अलग अलग ट्रीटमेंट होता है. एंड एज अ जनरल रूल, किसी भी काइंड ऑफ पिगमेंटेशन को सनलाइट एक्सपोजर बढ़ाता ही जाता है. सो कुछ ट्रीटमेंट स्टार्ट करने से पहले सनलाइट प्रोटेक्शन वुड बी द मोस्ट इम्पोर्टेंट. एंड ये सनलाइट प्रोटेक्शन नॉट ओनली ड्यूरिंग द ट्रीटमेंट बट ऑल्सो आफ्टर द ट्रीटमेंट उतना ही इम्पोर्टेंट होता है, सो दैट हमें जो पिगमेंटेशन हुआ है वो दोबारा ना हो जाए. सो दैट वुड बी द मोस्ट इम्पोर्टेंट. एंड कंसल्ट योर डर्मेटोलॉजिस्ट आपका एज कंडीशन डायग्नोज करने के लिए, टाइप ऑफ मेलाज्मा डायग्नोज करने के लिए, एंड आपकी स्किन टाइप के हिसाब से आपका ट्रीटमेंट कस्टमाइज करने के लिए.
Bilkul. Thank you so very much, Dr. Roopal Bansal. It was wonderful talking to you. It has been a very informative session for our viewers as well. Thank you so very much once again.
Thank you, Sayuktha. It's been a pleasure.
And viewers, thank you for your active participation in today's session. Stay connected to our beautiful Spotless Skin page and keep glowing. Bye. Take care.